Hello and welcome to Health Check, your weekly medical show right here at Hop TV. This week we'll be focusing on oral health in children and particularly children living with Down syndrome. Early intervention and daily oral care can allow these children have better health in their mouth and enjoy, living a healthy life. Now, to help us learn more about this topic, we are privileged to have Lily Mugane. She is a parent and the co-founder of T21 Family Support Organization. She'll be telling us more about that. Also in studio with us is Dr. Diana Okello Maranya. I had to say that slowly because I was baptizing her a different name. She's a pediatric dentist, yes, pediatric dentist and a clinical researcher to help us with this topic. So remember, we are live on Facebook and YouTube at Hop TV Kenya. You can share this link with a friend so that we can learn together. And for your comments and questions, engage with us. Our feedback platform is 20933. That is 20933 for our SMS. And our WhatsApp line is 0708 222 323. That is 0708 222 323. And my name is Grace Mutiso. Always a joy to be with you on Health Check. Allow me to introduce the beautiful ladies in studio with us. Good evening.
Good evening, Grace.
You doing well?
Yes. Thank you for having us.
Can't complain.
Okay.
It's a bit hot, but
It will get cold, don't worry. So let's me give you an opportunity to introduce yourself and let's start with Lily as you tell us a little bit about T21 organization and what prompted you to start it.
Okay, so thanks for having me. My name is Lily Mugane. Mugane being my husband, and we have 3 children. 2 girls and 1 boy. The girls are aged 14 and 12, and then the boy is turning 10. He's specific, turning 10, because he didn't want to be said to be 9.
Yes.
I'm proud to be their parents, and the boy is the one who's brought us here
Yes.
because he's the one who was born with Down syndrome. I'm proud to be his mother
Yes.
because he pushed me to a community I didn't even know existed. But I'm proud that I'm here. And as you asked, what prompted me or myself and others to start T21 Family Support Organization? T21 Family Support Organization was founded actually, Munene was 3 months when we got the diagnosis. We thought we were alone
Yes.
in the journey, but I met 4 other parents, so we were 5 or 7 of us who exchanged, oh, how have you been doing with this therapy? Where are you getting specialists from? So just exchanging resources and our knowledge. And we thought, why are we doing this instead of having a WhatsApp group, to exchange the ideas?
Yes.
But before we knew it, 5 years ago, the WhatsApp group had grown to over 100 people.
Wow.
So it was moms only. So just, oh, I met this mom at the hospital. Oh, I met this other mom in the mall. And so it had grown, and we said, we can't just keep exchanging. Clearly, we need to be a voice.
Yes.
We need to be known, because how many are we? I thought I was alone in the journey. So many other moms thought.
Yes.
So how about we have an organization? So 5 years ago, that is 2018, October, so we are going to be turning 6 years.
Wow.
We formed the T21 Family Support Organization, and it's been a journey for sure, ups and downs.
Yes.
But mostly we are grateful because it has informed us, it has built us. We have muscle.
Yes.
Now we can say we are many of us and not one mom walking around alone in the journey.
Interesting. And congratulations. 6 years is not a joke.
It's not.
That's such a long time.
Yeah, thank you.
And what's the meaning of T21?
T21 is, okay, if I go to the layman's language, an ordinary person, we say Down syndrome, but Down, if I would ask, what is Down syndrome?
Yes.
People think wako down, wako chini. But that's not it. It's named after the doctor who discovered the chromosome that causes this condition. So it's Downs. The doctor was called Down. So it's Down syndrome. But because of that naming, it's been given like a negative connotation, wako chini, wako tu uko chini.
Yeah.
So we said, why not give a better, uplifting name?
Yes.
So we picked trisomy because trisomy 21 is what causes
The
Down syndrome. But now we keep saying trisomy 21 families.
It's a long one.
That's a long one. So
Yes.
T21, and it sounds good. It's
Yes,
funky.
yes.
So we said T21 it is. So
Okay.
that we name it as it is. It
Okay.
represents Down syndrome, but it's not the Down that people think. We are giving it the actual name.
Okay. Thank you for clarifying that. And for sure, before we wrap up the program, we'll be asking this question: if a parent is out there, has a child with Down syndrome, how can they join the group? Is it across the country or only in Nairobi? Everything is in Nairobi.
Yes.
Imefika mashinani, you'll be helping us answer that question. Allow me to bring Dr. Diana. Dr. Karibu sana.
Thank you. Thank you
Yes.
for having me.
Yes.
Courtesy of Lily.
Yes.
But thanks for having me.
Welcome.
So my name is Dr. Diana. I'm a pediatric dentist. So pediatric dentistry is a branch of dentistry.
Yes.
So I'm specialized in treating children and especially individuals with special healthcare needs. So that means children with Down syndrome, cerebral palsy, and any other medical condition that needs specialized care, especially around their oral cavity.
Yes.
I'm a mom. I'm married. I have 3 children, and Aranya is my husband's name.
Yes.
Yes.
Your husband must be very happy today. They've been mentioned on TV.
Yes. Hi. And I'm
Yes.
also the co-founder of Riverdale Medical Center,
Yes.
where we practice.
Okay.
Yes.
Thank you. So let's start with you. Maybe Dr. Ray, help us define what is Down syndrome.
Okay. I think Lily did a good job at defining it, but simply put, it's a genetic condition. So when we talk about genes, we're talking about the blueprint that makes us, your personality, your physical traits, and what she mentioned about the trisomy 21, that's one of the types of Down syndrome. So there are different types.
Yes.
You can have trisomy 21, meaning you have an extra copy of the chromosome. And that is affecting all the cells.
Yes.
And then there's a different type where some cells are normal and some cells have a variation. They have extra genetic material. And then the third form is just a part of the chromosome is borrowed. So there are 3 types. There are
Yes.
actually 3 types. And in the 3 types, it's basically how the syndrome presents itself. So when we talk of a syndrome, we talk about a collection of traits that have been agreed upon to be consistent to name that condition. So when we talk about Down syndrome, it's consistent how these children present. Whether you're in Kenya, whether you're in America, wherever you are, it's consistent and agreed upon. So that's what is a syndrome.
Okay.
So yes, that is simply trying to put it simply.
Simply.
Yes.
Okay. And I've heard you kept saying symptoms present and they are consistent.
Yes.
So what are these symptoms? How do they present themselves?
Yes.
Yeah.
So physically, the diagnosis can be made at birth, meaning the pediatrician or the birthing attendant, whoever is there and is knowledgeable, they'll be able to pick certain clinical characteristics, such as how the eyes are shaped, how is the neck shaped, how are the fingers shaped, and they can pick certain traits that are suggestive. However, the definitive is actually genetic testing. That is the definitive diagnosis that tells you, okay, this child has Down syndrome. But because of cost and restriction with resources,
Yes.
most of the time a pediatrician or a specialist in developmental, like a developmental pediatrician can diagnose and say, okay, this is suggestive of Down syndrome. So from the oral cavity now, we have our own way
Yes.
of saying, okay, these are characteristics of children with who have Down syndrome. For example, most commonly they present with a larger tongue. So you'll see a large tongue that has fissures. These are the grooves on the tongue.
What are fissures?
Fissures are like
it?
a wave, but
Uh-huh.
an indentation in the tongue.
Like,
Inside the tongue.
Okay.
So you'll see the tongue has many fissures.
Yes.
And the tongue is larger than a normal tongue, which then, puts them at risk at placing it forward.
Yes.
Meaning out of the mouth. And then they tend to breathe with their mouth open.
Yes.
So we call them mouth breathers. And we can discuss that in depth when we are talking about the conditions.
Yes.
And then we also look at their teeth and how are their teeth positioned. So there are certain things that when we examine a child, we say, okay, so they've presented like this. What can we as specialists do to enhance their oral health? Yes.
Okay.
But that diagnosis usually comes from a medical professional.
Yes.
Before they come to us as dental professionals. Yes.
And if you're joining us right now, you are on Health Check. We are talking about oral health in children with Down syndrome. Please engage with us at Top TV Kenya on Facebook and YouTube. By the way, we are live on those platforms. You can also WhatsApp us your question or comment on 0708 222 323, or our SMS line is 20933. The numbers are right at the bottom of your screen. And I'm hosting Dr. Diana together with Lily as they help us discuss this topic. So back to Dr. Diana. Now, so what are some of the oral characteristics, of children with Down syndrome?
Okay. Broadly, we can look at them as the soft tissues. That means the tongue, the lips, those are the soft tissues of the oral cavity. The hard tissues are the teeth. So the different ways, first, we look at the tongue is enlarged. That means it's larger than normal and it has fissures.
Yes.
These are the grooves and the fissures on the tongue.
Yes.
So it's an enlarged tongue. And then with the other aspect is we look at the gums. Children with Down syndrome are predisposed to gum disease simply because, one, they are mouth breathers.
Yes.
And also because of reduced immunity, they are more predisposed to gingivitis, which is basically a gum issue.
Yes.
And now when we come to the hard tissues, which are the teeth, we look at the teeth from also just right from when the tooth is developing and growing. So while we expect the first tooth to come in at about 6 months, for children with Down syndrome, the first tooth may come in later. So we are looking at 1 year, 2 years. Sometimes they come to the dental clinic at 2 years. The mother is very concerned that the child doesn't yet have their first tooth. But we just tell them to be patient and wait. The tooth will come.
Yes.
At some point. So we can monitor that growth even till 5 years, till when they get their teeth. So what we call that in now medical terms is delayed eruption.
Yes.
So that comes to the teeth. Sometimes they may have extra teeth. So while we know the normal dentition might have 20 baby teeth and 32 adult teeth, there might be extra teeth, which we call either supernumerary or supplemental teeth. So these are more teeth than normal.
Yes.
And sometimes these teeth can get stuck in the jaw, meaning they don't come out until I do an X-ray and notice, oh, there are some teeth that have not yet grown, they are stuck or they are extra.
Yes.
And then now we make a decision as to what to do with those teeth. There may be spacing in between the teeth. For some children, they present with spacing, meaning the teeth are not touching each other.
Yes.
While with some, there is crowding, meaning because now there are more teeth, the teeth are not aligned well. And then now, because of the large tongue, some of them are, or most of them actually are mouth breathers. They breathe through the mouth. And that is not only because of the tongue.
Yes.
The face is divided into threes, like a third, a third, a third. So we say the middle third is reduced in size, and also their nasal passages are reduced. So that means they have reduced, like their efficiency to breathe is reduced. So they
Yes.
try to enhance it with the mouth. But what I recommend is for the parents out there and the caregivers that if you notice your child is breathing a lot through the mouth, snoring at night, you should visit an ENT.
Yes.
That is a doctor that is specialized in the ear, nose, and throat. They may have enlarged adenoids or tonsils, which is obstructing their breathing.
Okay.
Yes. So that is broadly what we would say how they present to us.
Okay.
Yeah.
And to get to Lily now, how was it for your son, when it comes to the oral issue?
I must say we've been blessed because, or maybe it's lack of knowledge. You see, now as she was talking, I
Yes.
was smiling. I'm like, because I remember, going off, and I was just thinking today in the morning, telling him, breathe with your nose.
Oh my.
Because we realized because
Yes.
of breathing with the mouth, then he easily gets throat infection.
Yeah.
So and I guess also even when he has like a flu or he gets blocked and the nasal passage is not as broad as the typical. Yeah, so I'm also learning in this. So anyway, from diagnosis to now, the oral health for him has not been too bad. I must say the crowding. Now I'm hearing terms
yes.
because there are times we'll see the teeth. We look at his teeth and they look like they are more, but maybe also because of the small jaw.
Yes.
See now, most of the time, as a parent with such our children, we end up looking at other issues. So there are other, maybe we would say more severe issues, the heart condition, is he the verbal? We forget the mouth.
Yes.
Cleaning, we will get there. Is
Yes.
he using the toilet? Are there other things? So maybe we've not been as keen even on these with him as we should be. But I must say, we do annual health checkups. At least we go to the dentist every year, and because we go as a family, he copies.
Yes.
He will see Mama has sat on the chair and they've been checked. Oh, they didn't get scared. Dad the same, and everyone. So even him, when it's his turn, he's looking forward and he will sit. But the teeth popped out late.
How late?
I think we got the first tooth 1.5 years. Yeah, and by that time, everyone, kids his age, they have teeth. But the good thing with that WhatsApp group, did your child get? Oh, not yet. But the surprising thing is, when it comes, we say they pop like popcorn.
Really?
Because now it came the first one, and then they don't follow the usual, two teeth. Then you could have this and then the canine. Then so they just pop like popcorn. You might not be able to predict which one is next. So after the delayed 1.5 years, it's come the first one, and then before we knew it, the mouth is full.
Yes.
The same thing even with the milk teeth, the first milk tooth. Luckily, his also came out, the first one on the 5th.
Yes.
Actually on the birthday, he removed the first tooth.
Wow.
We didn't even expect it. He was saying, like it's shaking. Okay, let's see. The next thing, it's out.
Yes.
So I believe I see many people saying our children also have a high threshold for pain. So even that, it's shaking, fine, he can shake it, and before you know it, it's out. So he's been able to remove the teeth. He actually even removes himself.
Yes.
He will just notify us, but that's also dangerous because we don't know when one is, loose. What are you doing with your teeth? Do you have a shaking tooth? Yeah, this one is shaking. And then you check.
Yes.
But again, there are some kids amongst us who are not verbal.
Yes.
So they might not say. So, and if you're not checking, you might not know that he has a shaking tooth, and then before he has others, the overgrown teeth. But Munene has not had a big issue, especially maybe because of doing it as a family, as a group. If it's brushing the teeth, he brushes them himself. He has, the way I said, many teeth. So I see like they can get intertwined. So sometimes I'm not very sure how clean that is. So the annual check for cleaning is also very key for us. But he copies his older sister. And brushing time, it's brushing time for everyone. So everyone is there with their toothbrush and they do,
Okay.
Yeah.
Before we get to Daktari, have you had any oral challenges with Munene?
Or not much, maybe just fearing now the removal.
Yes.
So when it's shaking and we realize it's shaking. Okay, calm. No, especially, I fear also. I don't know whether I passed it to him.
It's a mother's thing.
I can't. In fact, I say if it's not, I can't remove. If it's shaking, we'll go to the dentist. He'll even tell me this, shake.
Yes.
I'm looking, shake it.
Yes.
It's shaking. We go to the dentist.
Yes.
We'll go to the dentist. Luckily now the community, that's why it's good to bring up our children in a community.
Yes.
So the dad can remove, the grandfather can remove, but
Yes.
I just won't touch. So that's the challenge I have seen. And then dry mouth. Dry mouth. So there are times I will say you've not been drinking water.
Yes.
Because they get very dry. I don't know whether it's the glands that are not producing as
And
well.
the mouth breathing.
Yes,
The
and then the
mouth
mouth breathing, so
really
it
dries
dries.
up the mouth, yeah.
Oh yeah,
Yeah.
that must be because he has he gets dry mouth, and you'll even see.
The
You're like,
crack.
go take water. You've not been taking water,
Yes.
or you will even smell. You'll be like, his smell is off a bit.
Yes.
Yeah, but it's because of that dry mouth. So I would say that is actually a big thing for us.
Okay.
The dry mouth, and then the removal of the tooth.
Yes.
Yeah.
Okay. Dr. Diana, as Lily's talking, I'm just imagining when she comes, please, just do the necessary. So what are some of the other oral health issues you've observed with children with Down syndrome?
I think maybe not necessarily the oral challenges as she's described her experience,
Yes.
but we can even go a step back a bit
Yes.
to this child is in a home. And as I was listening, I really commend, Lily and Lily's family
Yes.
to be able to incorporate him in a plan and visit the dentist annually. I mean, there are many of us who don't visit the dentist annually or even every 6 months that we recommend. So this child is in a family, and sometimes the challenges that children with special healthcare needs face is just their dental needs are unmet, meaning they're just neglected.
Yes.
We've heard of stories where, children are hidden, children are locked away. So that's not even a discussion. So we start by the parents.
Yes.
If we can have this conversation with the parents, the viewers, where there is no shame. This is a child. They have rights. Actually, even in the law, they have rights. And you should take them.
Yes.
Take them because it affects their quality of life. The mouth, we say we are putting the mouth back into the body. For dentists, we are treated as this is your part.
Yes.
But as pediatric dentists, we look at the child as a whole.
Yes.
And the family. What is the family setup? So that when I tell you this is the challenge this child is having, they're having a cavity,
Yes.
meaning they're having dental caries. Can you institute these changes at home? Can you buy a toothbrush and do this? Can you buy a tongue scraper?
Yes.
And then maybe the mother will tell you, I can't afford. So I like saying we tailor make. When I examine the child, or when any dental professional will examine, you look back at what is the family setup.
Yes.
And try to tailor make something that works for them. If someone cannot afford 1, 2, 3, what else can they use?
Yes.
I may come up with a very elaborate plan that the parent may not. So we always have to keep the parents at the back of our mind when we are looking at these conditions. So they do get cavities just like any other child.
Yes.
They do get gum disease if we don't brush teeth. They will have, and they have now what I was calling an open bite, where the front teeth are not touching.
Yes.
And after we've examined, now we come up with a plan. And then we sit down with the parent or the caregiver and say, this is the best thing. You need to reduce on this. Now, unlike you who's taking Munene every year, there are other parents they feel guilt. Now the extreme
Yes.
of hiding the child is now this, you're very permissive. So you want to reward with the chocolates because you feel like you did something wrong. And you actually didn't do anything wrong. This is a spontaneous genetic happening.
Yes.
You didn't do anything wrong, but now you are constantly giving the child chocolates and crisps and sodas, and then they come to us with a toothache. Yes, so I would say that they do have just common problems like any other child.
Yes.
They can have a cavity, they can have bleeding gums, just like any other child. But we need to pay special attention
Yes.
because just unlike any other child, there is the family. that might want to hide them, might not want to spend on them, and of course the challenges of cost and insurance and all that.
Okay.
Yeah.
Maybe I can help Daktari.
Yes.
I can add
Yes.
to Daktari's what she's saying.
Yes.
We've also realized in our conversations with parents, some of us, we are not able to take the children to the dentist because maybe of the facility.
Yes.
First, our children might be having anxiety issues, or so we go. It might be a longer visit.
Yes.
So the doctor is thinking we had booked 1 hour. Here we are.
3 hours
First, are you
later.
going to sit or not?
Yes.
So maybe dentists who are accommodative enough to understand that, this is Munene's appointment.
Yes.
So don't block for the next 30.
Yes.
But that might also mean, so the next 30, my income. In the meantime, what happens,
Yes.
So maybe it's a balance, it's a balance for that. And I was also thinking specialized care for, you see, even to have that child there. Even removing that tooth, I
Yes.
might be scared as a parent, but the dentist might need, there are some who have to be put down. Because
You're
putting that plug in that mouth, that it might be as simple for a typical 5-year-old, it's
Yes.
easy, open, okay,
Yes.
fine. But this one, if you don't put them down,
They can't.
then how many dentists have that facility
Yes.
to put a child down? And how many parents are open to have their child
child
put down
Yes.
for
That's
dental care?
Yeah.
And our children also have heart conditions.
Yes.
So you might need clearance from a
Yes.
cardiologist
Yes,
before
before
you
they
say
go
you're
down.
putting.
That's true.
Wow,
That's
I
true.
hear.
Yeah.
Okay.
That's true.
Allow us to pause here for a quick break. When we come back, we'll continue this discussion. I'm hosting Dr. Diana. She is a pediatric dentist and a clinical researcher. I'm also hosting Lily Mugane. Lily is a parent of Munene, and Munene, a handsome young man living with Down syndrome. And she's also the co-founder of T12 Family Support Organization that brings together parents who have children with Down syndrome and just to offer that support for them. Let's have this quick break. When we come back, we'll continue this discussion about oral health in children with Down syndrome. This is Health Check right here at Hope TV.
Welcome to the world of Hope Media, a media unit of Christ is the Answer Ministries that is committed to spreading the gospel of our Lord Jesus Christ through the transformative power of media. Hope Media is dedicated to utilizing various forms of media to spread the message of hope, love, and redemption to all people around the world. Hope Media consists of various units that work together to achieve this goal. These units include Hope FM. Hope FM is your #1 Christian radio station offering you discussions on current day-to-day issues, inspiring music, life-changing sermons, and news updates, broadcasting 80% in English and 20% in Swahili, with listenership of over 12 million every month. Hope TV. Hope TV programming is designed to inspire, educate, and challenge the viewer with wholesome content to reach various demographic groups, children, youth, and adults, both male and female, with viewership of over 24 million every month. Hope Recording Studios. Hope Recording Studios is a state-of-the-art recording facility that offers high-quality recording, mixing, and mastering services. It is designed to meet the needs of musicians, artists, and other creative professionals who require top-notch recording facilities. Hope Creative. At Hope Creatives, we believe that inspiring graphic design work doesn't just happen. It takes the right people with wild out-of-the-box ideas committed to the same ideals, working together to make it happen. We listen, we learn, we brand. Hope Digital. Hope Digital is a creative digital unit within Hope Media. We are driven by a passion to creatively express ourselves while influencing you with the same creative energy in online spaces and beyond. At Hope Media, we believe that media can be a powerful tool for spreading the message of hope as well as grow your business through advertisements. And we do this with excellence. For more information regarding our services, please visit www.hopemediakenya.org or call us on 0709 861 180. Hope Media. We keep hope alive. In order to keep hope alive in the airwaves, Hope Media has a couple of initiatives. Friends of Hope. Friends of Hope is you and I forming a team of well-wishers and volunteers who give in cash and kind to support in spreading the gospel at Hope Media. Currently, Hope Media is running a campaign under Friends of Hope dubbed 100 for 1. Through the campaign, Hope Media is asking Hope FM and Hope TV listeners and viewers to give just 100 shillings in order to reach one more soul with the message of hope and the gospel. Engage with us on our social media platforms at Hope FM Live and at Hope TV Kenya. Kuwa rafiki mso leo.
Welcome back to Health Check right here, Top TV Look and Live. My name is Grace Mutiso. We are talking about oral health in children with Down syndrome. Do you have any question or you want to engage with us? Our WhatsApp line and SMS line are right at the bottom of your screen. You can also engage with us at Top TV Kenya. We are live on Facebook and YouTube, and I hope you've shared this link with a friend. So allow me to bring back my guests with us. Let's go to Lily before we bring back Dr. Diana to help us know, so how do we sort our children's oral health? So what are some of the tips that have worked for you when it comes to taking care of Mnene's oral health?
I must say the group work,
Yes.
doing it as a family. And when it is brushing time, it's everyone. So he's lucky to be the last born. So he has no choice but to just follow the
Yes.
others. But that has really helped. Also trying not to have too many sugary stuff. They are children, they'll want to do sodas, they'll want to do biscuits.
Yes.
My children themselves bake cookies. So we have to remember we limit as much as possible. And if you do, in fact, I remember when there are parties, we have to gargle.
Yes.
So whenever you've had too much sugar, sodas or cake, at night after you brush, we gargle. And when he's gargling salty water, he will count. So that is also learning.
Yes.
1, 2, no, you skipped a number. Start again.
Yes.
1. So
Yes.
that has really worked for us. And repeating
Yes.
over and over and not getting tired. Another thing for removing the tooth, I guess he's going to be a businessman because he loves money. Tooth fairy.
Yes.
So that entices, another tooth.
Yes.
I'll get her more money
Yeah.
to build a mansion.
Yes.
So motivating him.
Yes.
So he won't hide it because he knows when he shows it to you, Tooth Fairy is going to come and
Yes.
reward him.
Yeah.
So that has been
helped.
a savior. Yeah.
Were you scared when you at the thought of this is day one of brushing him? How do I go about it?
I can't even remember how
Okay.
we did the first time.
Yes.
Because most of the time it's here.
Yes.
What do it's taking and moving.
Yes.
So it is. I remember actually, before the teeth came out, we used to use just a cloth.
Yes.
I would give him a cloth to chew on it,
Yes.
dipped in salty water,
Yes.
just chew on it. So when finally he got a tooth, how do you even start brushing?
Yes.
But luckily in the market, we have some very soft toothbrushes. So we were not really scared. We just started off, him being the third born,
Yes.
the same way the others have done,
Yes.
with 1 tooth, with 3 teeth. We didn't think it was any different.
Okay.
But just the difference we saw was he's late, and then they're popping
Everywhere.
Yeah.
Like popcorn.
Like popcorn.
Okay. So, thank you, Lily. So let's go to that. I think one of the questions, parents who are watching could be wondering, so how do you go about cleaning the teeth of a child who has Down syndrome and just ensuring they are safe? Because at the beginning we mentioned they breathe through their mouth, so that means mouth is really critical in helping them breathe, but so still need to ensure they're healthy in their mouth. Yeah.
So I would say that these are some of the cleaning aids that we use.
Yes.
And this is just a model of the mouth. So first thing is we need to start brushing from the moment the first tooth comes in. From the moment you see the first tooth, you need to start brushing. And what are we using to brush? You're using a brush and toothpaste. I didn't carry toothpaste, but any toothpaste that has fluoride.
Is it for the adult one or we go for the children
So
one?
you go for the age appropriate.
Okay.
So are you doing 0 to 2? Are you using 2 to 5? But as I mentioned, there's that delayed eruption. That's why the practitioner is very key to advise what are we using and how much should we use. So when we are introducing, we say just a smear, like the grain of rice.
Yes.
That's, you just use a smear of toothpaste and then you angulate the brush at 45 degrees to get as close to the gum line as possible.
Yes.
As I mentioned, they are at risk to get, increased risk to get gum issues and gum disease. So you need to clean close to the gum. You've angulated at 45 degrees.
Yes.
Now, once you've done that all around and all the surfaces of the gum, including on the inside, you now make circular, nice circular motions. Now, for children with the Down syndrome, they need to be either assisted or supervised, or you perform it for them, meaning you brush the teeth for them. Because, well, they are children. In fact, we usually say till about 8 years, 9 years, you need to be supervising and guiding them on how to brush. So you make nice circles. You can tell them, go round and round, round and round.
As you sing the waves of the bus.
In fact, what she mentioned is a technique we use in dentistry, which is called modeling. So you use one child, so maybe the elder sibling is, brushing. And so Munene is looking and thinking, oh, let me also do it. So that's it's very positive. It's a very positive way to teach them how to brush. So once you've done your circular motions, you make sure you also brush the biting surfaces. So that's the back teeth and the up teeth. And when we finish, if you have a toothbrush, you can clean the tongue in a sweeping motion. Or if you have a tongue scraper, this is a tongue scraper, you can just scrape the tongue as you remove the food particles. So usually the food particles that are left on the tongue, that's what is causing the bad breath, in addition to the mouth breathing, which leaves the mouth very dry. So you make sure you remove all the food particles from the tongue. There are other cleaning aids, such as, we have dental floss and small brushes called interdental brushes. These are very small brushes that are used to clean in between the teeth. Now, all this depends on how the teeth are arranged. If there's space, well, that means there's good flow of saliva and, the toothpaste with fluoride can flow. But if there's no space, you can use either a brush or dental floss, which is a small string you pass in between the teeth to make sure in between the teeth we have not left any food. So it's very critical. What I would advise is that if the child has any form of gum disease, meaning the gums bleed easily, please take the child to a dental professional. It doesn't have to be a pediatric dentist, but any dental professional will guide on how to brush. And if any specialized equipment is needed, as you mentioned, depending on the complexity, they will refer appropriately. But brushing is a basic thing, a basic practice that should begin immediately that first tooth comes in.
So, and then how often should we use the brush? In Kenya, we can use for a year. Until they bite and they chew them.
We usually say 3 months you should change. But we also advise that anytime the child has had a cough or a cold, change the brush. Change the brush, get a new brush. A soft brush or a medium brush or a toothbrush for children. Use that for your child.
If they've had a cough, change.
Change. And all this is what we are saying, why I keep referring to the dental professional, is because they are also, in addition to all the efforts at home, there is also that guidance from the dentist who will tell you, okay, maybe for Munene, once a year is fine. But maybe for another child who we classify as high risk, meaning high risk to get some dental conditions, I want to see the child 3 months, after 3 months, or after 6 months, because I'm monitoring maybe some guidance, some advice I've given the parent. So please don't forget the dental professional. Our medical colleagues, we always say when we are treating a child who has a syndrome, as I mentioned, very many characteristics, it's a team.
Yes.
It's a team effort to take care. She mentioned the cardiologist. There are so many other professionals in that team. And always we plead with our medics to not forget us, because
Yes.
the parent might be none the wiser to know that, oh, I need to take the child to a dentist.
Yes.
So the dentist should form part of that team when
Okay.
taking care of the child. Yes.
So let's assume scenario that, a child has been brought to you
Yes.
and found to have gum disease.
Yes.
Or any of those oral conditions. So how do you manage and how do you work with the parent to ensure this child heals well and heals faster?
Okay. So usually we start with that conversation, which in medicine is called a history.
Yes.
You start with the conversation that, why have you come? Why have you brought Munene? Okay, when did this start? You get the story behind why they've come. Once you've done that, you will examine the child, meaning you will try and sit the child on the dental unit if they are able, if not, even on the parent's lap, whichever way is comfortable for the child.
Yes.
You have a look in the mouth, be able to see, okay, maybe there's a cavity, the gums are like this, the tongue is like this. You come up with what we call an impression, an idea of what is going on.
Yes.
Sometimes the doctor or the dentist will ask for an x-ray. For the children who will tolerate, they do the x-ray. If not, now you are limited to what you have seen with your eyes. So usually with the gum disease, the most basic form is cleaning.
Yes.
That is the most basic form. It sounds funny that why are we cleaning and the gum is bleeding? Maybe I should stop cleaning because every time I clean, the gum is bleeding. But it's a vicious cycle.
Yes.
So we usually tell the parent that let's start with cleaning. And then we institute some measures at home. The dentist may prescribe a mouthwash or some practices at home to make sure the gums at least settle down. And then for cavities, there's a wide array of treatment in terms of the child's also ability to sit still. Some of the children might not sit still. They may have anxiety.
Yes.
So that's why it's very tailor-made.
Yes.
When you come to a specialist, it's very tailor-made to Munene, to anyone else, to any other child. And say, okay, this child can tolerate, let's do it on the unit.
Yes.
This other child can't. What are the options? And then we discuss it with the parent.
Yes.
Yeah.
And you're talking, Dr. Diana, you're saying that, and I'm imagining a parent who could be struggling and say, my child can't just sit still.
Yes.
So what do? I really need them to get this help, but they can't even start getting into a dentist's office. So such kind of parents, how would you advise them?
I think the first step is to come. That is the first step. Even that
but
sitting
a child
still.
Can't sit still. You can't even examine them.
That is the parent. We have all manner of ways to examine a child.
Yes.
There are all types of methods we can use and assess. Really, is it just hyperactivity or really the child's inability to cooperate? So in case we have, as I said, we have different methods. Sometimes we may need medicine to help the child calm down.
Yes.
But usually all that, it needs the parent, the child, the pediatrician or the primary doctor, and you come up with a plan and say, okay, this child is unable.
Yes.
They are truly unable to open, to cooperate.
Yes.
What can we do? What can we do to treat them?
Yes.
Now, in case you need to take the child to theater, that is a whole other process.
Yeah.
Yes. Where we need clearance from the pediatrician, and we do whatever treatment we offer should be done in a safe manner.
Yes.
Yeah.
Okay. So parents, stop being afraid. Please take your children to the dentist. That's really important. So coming to Lily, this is a very important question. I'd love to hear you speak from your heart. How have you been able to manage stigma?
Wow, yeah.
Have you even gone through it?
Yeah. Stigma is there.
Yes.
It's real. You don't realize. I say we are all in a bubble, and we are all in a. We say, oh, he's in a bubble, but you're all in a own kind of bubble.
Yeah.
When we got Munene, I didn't know much about Down syndrome. Now coming out and then now Googling and seeing, I was like, okay. And then you go and people are looking at you. thinking, why are you looking at us? Oh, it's Munene. But what has helped, the first thing, how to manage, what has helped us is acceptance.
Yes.
So when someone looks, I don't think negative. I think positive. I'll say, Munene, say hi.
Yes.
So if you are thinking negatively and then he comes and say, hi, what's your name?
Yes.
Then it changes the ball game. So
Yes.
accepting, so that has allowed us to take him to any place. Sometimes we even forget that there is any syndrome, that he's carrying any extra chromosome, because we go with him everywhere. It's until with his peers and you realize he's not matching completely.
Yes.
But you put him out there. But we've had stories, even now, especially being in T21, there was the group of parents who've been told, oh, it's because your husband didn't pay dowry, or, as we were trying to look at the characteristics, or you'll be told the eyes are like for Chinese, the Thika Road, you stay on Thika Road, we know what you did.
Oh,
There are those
my.
Chinese guys, or uchawi. We see lots of that, especially in the coastal areas. Then that's why, as Dr. Ru was saying, people are still locking up their children. So one of my why for being a co-founder for T21 was, when we got Munene, we thought we were the only ones.
Yes.
But there's so many people. Why aren't they being brought out? Because research shows it's one of the most common chromosomal disorder.
Yes.
So where are they? I look for, where are 40-year-old people in Kenya with Down
yes.
syndrome? I don't see.
Yes.
So it means they were hidden, or maybe they are we don't know where they are. So my motive, or our motive as the founder members, was to put it out there,
Yes.
so that then the parents are not stigmatized. You don't think you're alone, or it's uchawi because your neighbor has said, or your auntie said your husband didn't pay dowry. So dealing with it is by talking more, and even, I see, like, you guys have hosted us to talk about this, someone to see and say, oh, I'm not alone. It has helped me even push more. Lily, why didn't I? You want to meet Munene? There are times I've been, you want to, but he looks.
Okay.
But it's because we have freely shared the information, and also left him to be. So stigma is actually, I say, it's very internal.
Yes.
If you can fight it yourself, people treat you the way you treat yourself, or how you want to be treated. Even your child will be treated the way you treat them.
Yes.
If you hide them, your neighbor will hide theirs, or will hide even yours when they go to their house.
Yes.
If they see you all out and you treat them like any other, then. But very important is advocacy,
Yes.
to deal with that. Talking and talking and talking, and telling who needs to hear, the lawmakers, the policy changers,
Yes.
that we need to talk about this and recognize that there's a group of people
Yes.
who need specialized attention.
Okay.
So, and that way they will stop feeling, oh, we are the minority, so let's hide. Oh, now the stigma, comes with, I'm not good. I'm not so. But if it's out there, the lawmakers are pushing schools. Why don't you have a child with Down syndrome in your
school,
class?
yes.
Then they will push
Yes.
the parents who are there, because there are some parents who have their children, but they are not in that school,
Yes.
to bring them.
Okay.
Some motivations, and just speaking out and saying. It's as Dr. Diana said, it's not anything that you did. It's God's doing.
Yes.
In fact, that's one of my reasons for accepting so easily. As
Yes.
human beings, we look for, who can I blame? It's that Daktari, it is. So when we realize Down syndrome, there's nothing to blame.
Yes.
Just accept.
Accept.
Yeah.
So we have a few minutes to wrap it up. How can someone join T21 family?
T21 Family Support Organization. We have an office.
Yes.
We are off Moshai Drive on Ngong Road. So there's a road off Moshai. There's a road called Baruch Road.
Yes.
We've been graciously hosted by a therapy organization. They're called Ability Therapy Place. So they are hosting us there. We have an office. But more to that, we are on Facebook, T21 Family Support Organization. We are on Instagram. We have a YouTube channel. We are on Twitter, so you can follow us. And you can call our office line.
Yes.
I hope I have it right. But 0110 093 321. 321, don't forget, because it means the 321
Yes.
is March 21st,
Yes.
which is World Down Syndrome Day.
Wow.
So we are actually heading there.
Okay.
Yeah.
Thank you. So, Dr. Diana, to you, as we wrap it up, just tips on how to take care of our dental health for our children who have Down syndrome, and also where can we find you?
Okay, I think importantly, I would just advise parents to start seeing the dentist as early as that first tooth. Visit the dentist. We establish what is called a dental home. That
Yes.
ongoing relationship between me, you, and the child. When you start early, you institute the preventive measures. You're taught how to brush correctly, how to, use these cleaning aids correctly. So preventive measures, what to eat, what to avoid, to start early. That's what I would really advise. So that is really my message to the parents.
Yes.
If you see that first tooth, please visit a dentist. And if you do have a child with special healthcare needs, a child with Down syndrome or any other condition, please don't forget the mouth.
Yes.
It does improve their quality of life. You shouldn't assume that it's just a tooth. Imagine walking around with a toothache and you can't communicate that you have a toothache. So it does improve their quality of life. So please, parents, remember the dentist in that equation.
Yes.
Yes. So in terms of cleaning, I think I've explained. Parents, buy that toothbrush, immediately you see that tooth.
Yes.
Yes. And my practice is at Riverdale Medical Center. I'm one of the co-founders, and we are located in Lavington near Naivas and on Kiambu Road at K Mall. And our contact is 0722 50 48 48. Yes.
Okay. Thank you. So we really want to appreciate you for coming.
Thank you for
Dr.
having us.
Ray.
Thank you.
We won't fear. We'll bring our children.
Thank you
For
for
our
having
children.
us.
And thank you, Lily, for also coming and just sharing your amazing story about the handsome Munene.
Thank
One day
you.
I'll come to meet
Oh,
Munene,
yes.
isn't
You
it?
should, you
Yeah.
should.
And thank you. If you're watching us and you have a child with Down syndrome, there is a support group for you. Lily has mentioned. Please check them out. T21 Family on Facebook, Twitter, Instagram, everywhere, even TikTok. Wako hapo. And please engage with them. And of course, also Dr. Diana, you can check her out. My name is Grace Mutiso. I want to wish you a blessed evening and thank you for watching tonight's episode of Health Check. God willing, let's do this again next week on Tuesday. Of course, different doctors and a different topic. Have a blessed night and keep it Top TV. Look and live. Bye.